name is Olivia and I'm a student physical therapist. In this video, I'm going to be reviewing some movements to avoid when recovering from a recent hip surgery using the posterior hip approach and all the precautions that come along with it. The three main motions to avoid are no internal rotation at the hip, which is not letting your knee go inwards, no adduction, which is not letting your leg cross midline, which happens when you cross your ankles, and no hip flexion past 90 degrees, so thinking about your trunk-femur relationship and not letting that angle get any smaller than 90 degrees. These three movements should be avoided to ensure proper healing and to avoid hip dislocation. Internal rotation at the hip happens when you let your knees touch or your toes go inwards. It's important to avoid these two motions when sitting and when standing, keeping your hips and feet aligned facing forward. Hip internal rotation also occurs when you turn your body by keeping your lower body planted and moving your upper torso. Because of this, it's really important to take small steps when turning around. Hip adduction occurs when you cross your legs in sitting or when putting on your shoes or socks. Using a sock aid can help you avoid these motions. To avoid hip flexion past 90 degrees, it's important to avoid low chairs and toilets as they break this precaution. As you can see, this low couch decreases the angle between my trunk and hip, making it less than 90 degrees. Additionally, it is important to keep your trunk upright when standing up from a chair to avoid too much flexion at the hip. As you can see, that occurs when I lean my trunk too far forward when standing. Reaching down to pick something up off the floor also breaks this precaution. To avoid this, using a reacher or the assistance from someone else is most helpful. Even when reaching for the covers at the end of the bed, it's important to use a reacher to avoid too much flexion at the hip, as seen here. Getting into and out of the bed is an activity where people are prone to break all three of these precautions. That is seen in this video with my knee and leg rotating and moving inwards and my knees flexing past 90 degrees. There are a couple different ways to maintain all three precautions when getting into and out of the bed. The first method is the long sit method. This is where you lift your trunk up and slowly move your legs over to the edge of the bed, avoiding adducting the operated leg past midline. Another method is called the log roll with a pillow. This is where you bend both knees and place a pillow in between to avoid adducting the operated leg. You then reach for the edge of the bed, moving your trunk and legs together, swinging your legs over the edge of the bed, and using your arms to help push yourself up. Lastly is the leg lift method. If your operated leg is still feeling weak when getting in and out of the bed, a leg lifter can be used for assistance.